Kia ora koutou katoa, no mai haere mai ki te manatū haora. Nice to see you all back here today. As you would have heard a little earlier on, the Prime Minister has announced that Medsafe has approved the conditions of the Pfizer-BioNTech COVID-19 vaccine for use in New Zealand. That provisional approval was agreed and gazetted today by Medsafe, and I've got with me here Chris James, who's the Group Manager of Medsafe, who'll talk shortly and help me with responding to your questions. So the provisional approval is very much the start of a new chapter in New Zealand's COVID-19 response and a significant milestone in that response. I do want to recognise the work of Chris and his team at Medsafe, our country's medicines regulator, in working so hard to get to this point of approving this vaccine, alongside the analysis and advice provided by the Medicines Assessment Advisory Committee that met yesterday. The most important things that have been under consideration in this process, and Chris will talk more to this, are the safety and effectiveness of the vaccine and the quality of its production. The assessment process that Medsafe undertakes, as with all the medicines, is extremely robust. Staff there have worked for many months to assess clinical trial data, and more recently, they've been able to draw on the real-world immunisation from data from countries that are already rolling out vaccines to their populations. And Chris will speak shortly to you more about this process, but I just want to emphasise that point for you and for all New Zealanders, that safety and efficacy are paramount considerations. You've heard the Prime Minister, and I've mentioned provisional approval or approval with conditions, and what this means is that whilst the vaccine has been approved by Medsafe, it has set conditions that the country continues to provide them with ongoing clinical trial data and data from manufacturing sites. And again, Chris can speak further to this. That ongoing data provision and analysis will continue in parallel with the rollout, just as it is in other countries that are already vaccinating their populations. Alongside the process that Medsafe has been doing, the Ministry of Health's Chief Science Advisor, Dr. Ian Town, has assembled a technical advisory group to provide advice to the government on the use of the vaccine, which populations it is most suitable for, and the conditions in which it should be used, this particular Pfizer vaccine, and further announcements will be made on that. Accordingly, that group meets tomorrow. As ministers and I have said before, the priority, though, we know, is to vaccinate people who at the moment are at highest risk because they are exposed more than the general population to COVID-19, and that is, of course, our border, managed isolation and quarantine workers, and the people they live with. This, of course, includes the staff, including cleaners, waiting staff, kitchen staff at the hotels that are managed isolation facilities, the nurses and healthcare assistants that do the health checks and the COVID-19 testing, security staff, as well as officials at our border, customs and MPI officials, airline staff, including aircrew, and others, as you would imagine. It does also include workers at our ports. Again, we'll share more details on how the program will roll out, and as the information becomes available and firm around the expected timeframes that the vaccine will arrive in New Zealand during this first quarter. But I do want to hand over now to Chris to talk more about the approval process and more about this Pfizer-BioNTech vaccine. And after that, we will take your questions. Thank you.
Thanks, Ashley. Good afternoon. So as announced by the Prime Minister today, Medsafe formally gazetted a decision to grant provisional consent or approval for the use of Comirnaty, which is the Pfizer-BioNTech vaccine here in New Zealand. So this was a carefully considered decision, and it was made following a robust assessment, which routinely we use here at Medsafe. We needed to be assured that the vaccine was safe and effective in a New Zealand setting, and that the vaccine was manufactured to a high quality. We have determined that this is the case. So I wanted to give you a brief overview of the approval process and the data we've been assessing to make our decision. So we've been working with Pfizer for a number of months now, and we started receiving some data back in November. We streamlined our assessment process. So instead of receiving a huge chunk of data right at the end, we allowed the companies to provide us with rolling submissions of data. So as the data was available, they could send it to us and we could start assessing it. And what this meant was we could streamline our assessment process, but it didn't compromise the rigor of our review or the requirements that we needed to ensure were met. And this is the same as we will be doing for all of the COVID vaccines. So it's important that people understand we have not cut any corners in the assessment along the way while we worked to make a decision. So there are three key aspects that we assessed. The first is clearly important is efficacy. How effective is this vaccine? And this is determined by results from clinical studies and information that we've received from the manufacturer, for instance, from Pfizer, from their clinical trials. Second key component is safety. Also very important, and this is received both from clinical studies, but also New Zealand has been in a fortunate position where we've been able to learn from other countries who have already started vaccinating their populations and receiving data regularly from our regulatory partners overseas, from countries that have administered millions of doses of their vaccine. We then took all the data together and you effectively do what's called a benefit risk assessment, looking at the benefits of the vaccine and any risks, such as side effects or unknown risks. We've also ensured that the company can manufacture the vaccine to a high quality. And this means that all batches are consistent, that the vaccine that we're receiving in New Zealand is manufactured to a really high quality, and that's very important. So Medsafe to the Medicines Assessment Advisory Committee yesterday for its review, so it could provide Medsafe with advice and some recommendations. Now, the MAC is made up of a range of experts from around New Zealand, and yesterday it met for around about 6 hours to go through this entire assessment. It was a very robust discussion and really helpful for Medsafe. And as Dr. Bloomfield's mentioned, Medsafe has granted provisional approval. So provisional approval allows us to place conditions on the company. So it must provide Medsafe with additional information as it becomes available. We've placed 58 conditions on the approval for Pfizer and BioNTech vaccine. And of these, 52 relate to manufacturing information. So just to help explain that, as companies upscale their manufacture from, say, making 10,000 doses to making 100,000 doses, they need to provide us with information to make sure the vaccine is still a very high quality for the vaccine we're getting in New Zealand. And that's why we put those conditions in place. We've also added 6 conditions for additional clinical information, and this requires Pfizer to provide us with regular updates from their own ongoing clinical studies and to inform the regulator as soon as they know if there are any possible safety concerns from around the world. So it's very helpful for us. But Medsafe's work doesn't stop there. So as with all medicines and vaccines, Medsafe will be monitoring the use of this vaccine, such as analysing reports, collecting reports of possible side effects, as we do for all. We've also published information on our website, and this includes the medicine data sheet for the Pfizer vaccine, and also some information that's specifically written for consumers to give them information about the vaccine. And we've also published the Gazette notice, which has all the conditions attached with it. Thank you.
So stay right there, Chris. Right, we'll open it up for questions.
Chris, can I just ask you to clarify something you just mentioned before? You talked about the meeting being 6 hours and it being a robust discussion. Why did it take so long when it's been approved all around the world? What was so intense? Why was the discussion so intense?
Well, firstly, it's very important that in New Zealand we undertook a robust process of the data. And there is a lot of technical data that comes through with these assessments. So Medsafe assessment report in itself numbered in the hundreds of pages. And so we wanted the committee to, we presented to the committee on the range of, say, manufacturing information, clinical information, toxicology information that we could then bring together for recommendation about the vaccine. So it was really important we had a robust process in New Zealand so we can provide reassurance to New Zealanders that the vaccine is safe and effective and made to a high quality.
How is the vaccine getting here? Would it be shipped or transported? Would it be shipped or transported by air? And is it coming with the Australian shipment?
Yes, thanks for that question. Yes, it will be coming by air, and we are certainly working closely with both Australia and with Pfizer to try and coordinate the shipments, and in particular to see if we can, and we have put in orders for vaccine from the same batch as the Australians.
Is the Pfizer vaccine ready yet, and how long will it take to arrive?
Well, it's already being used in countries around the world, so it's already been manufactured at scale. And just to reiterate, as we've said before, we're expecting it in the first quarter of this year, so before the end of March, and we are prepared to make sure we are ready to use it if it arrives sooner rather than later in that quarter.
How disappointed are you that it's just that small batch that's arriving first, that it's just for the border workers and their families and not any broader than that?
I'm not at all disappointed. I'm actually very excited. And and just to point out, and the WHO Director General made this comment today too, I was thrilled to hear from Chris yesterday that this approval had come through. It is less than a year since the WHO declared a pandemic of COVID-19. I'm not sure it even had the name COVID-19 a year ago. And here we are with the first of what we know are several effective vaccines that have been developed and administered now to millions of people around the globe. So I'm excited about the fact that we have got an approval, that we have been are working hard to ensure we are ready to use the vaccine once it arrives, and that we can gear up our system to deliver the vaccine to every Kiwi who wants to have it.
Because I think New Zealanders understand why we're not first in the queue for the mass vaccinations, but the question is why it's taken so long to get vaccinations for our border workers who are our front line. Can you explain that?
Well, we always said it was the first quarter, and we're only a third of the way into this quarter, and we already have approval. And as you know, we've got ongoing discussion with Pfizer about getting the vaccine here. As soon as we are confident, we know the date that it's arriving, then that will be made public. And just to say, in terms of the size of the batch, we are expecting in that before the end of the quarter, the first 225,000 courses, so that's 450,000 doses. So that allows us to vaccinate a significant number of people who are at the moment the highest risk, starting with those who are working at the border.
Chris, looking through the data, were you able to ascertain at any level whether this vaccine is giving people sterile immunity, whether they are not only stopping the vaccine, becoming sick from COVID, but stopping being able to transmit the virus onto anyone else?
So no, the data available at this stage does not confirm whether it reduces transmission. That's one of the reasons why we require additional information from Pfizer. So when that data starts coming through, we'll know as soon as possible.
Looking at the mass vaccinations around the world with this vaccine so far, is there anything that indicates whether it does or not, or is that still to be doubt?
Most of the data that we're receiving internationally is on side effect reports. And that's really useful because that's helped to confirm what we're seeing in clinical trials, that that predominantly the side effects being reported are minor side effects around sort of sore arm, people experiencing headache, feeling a bit fatigued, for instance. And it's really valuable that the information we've received internationally helps to confirm what's in the clinical trials, but we're yet to get any information that talks to does this prevent transmission, for instance?
To clarify on the 58 conditions that Medsafe has put on the vaccine, does that mean if Pfizer doesn't adhere to those conditions that they could get the red light at some point?
So we've put timeframes and talked to Pfizer about those conditions and timeframes of when we're expecting that information. Now, any manufacturer in manufacturing medicines or vaccines can, when they're trying to upscale, they may run into difficulties. We keep an open dialogue with Pfizer, and so I wouldn't put an absolute on that, but we would certainly expect that if Pfizer can't provide that information as they've agreed to, they would need to talk to us, and we would need to mutually agree when it would be provided.
Is the Pfizer vaccine safe to be used on people who are elderly, sick or pregnant?
So we've approved the vaccine for 16 years and older, and we haven't put a age limit on that.
Where is it being manufactured?
It's being manufactured in, the companies tend to use a lot of different sites for like the starting material and then putting it into the vials. So predominantly in Germany, Belgium, the US.
And also, does Medsafe have any role in, in other countries are delaying the second dose in UK and US? I mean, would Medsafe be telling New Zealand not to roll it out, not to delay the second jab?
So what Medsafe does is we review the data and then we provide the recommendation and approval, and the recommended dosing for that we've approved for the vaccine is 2 doses that are 21 days apart.
The second component you
So can I just add to that? And the other group I talked about that Dr. Ian Town is chairing will be providing advice on that. At this point, of course, there's no need for New Zealand to defer and delay that second dose, and we will be planning to roll it out, given our current situation, in accordance with the recommendation from Medsafe, and that is so that everyone receives that second dose 3 to 4 weeks after the first.
And who's actually in charge of the logistics of, getting the vaccine to the appropriate people who are going to be giving the injection?
The Ministry of Health is responsible for that, working closely with all the district health boards, and there's a team of now nearly 100 people in the building here that's been working for several months on that, and we will be able to provide more information once we're closer to the date about that whole logistics process of how we're going to be confident we not only have the vaccine here, but that we can get it out. Recalling that this first the Pfizer vaccine is the one that requires the -70 cold chain. And that will, once it's been taken out of -70, it needs to be used within 5 days. So there's a reasonable period of time, but obviously being confident we can maintain that cold chain through the distribution will be really important.
You both spoke about the second component being safety. What do you say to some of the people that are who are just a little unsure on the vaccine and won't be getting the vaccine immediately because it's been so fast and there's been such a fast turnaround?
Look, I can understand why people want to be really confident about the effectiveness and particularly the safety of the vaccine. And I can make 2 comments. The first is I have great confidence in the process that Medsafe has undertaken, and as just emphasised, as Chris said, no corners have been cut here. We have gone through a robust process. The second is, and Chris also made this comment, is every day, every week, we're getting more data from around the world as millions more of both this vaccine and other vaccines are administered. And there is nothing out of the ordinary from what we are seeing from the safety data that is coming through. It's very reassuring.
Yes, Dr.
Can I just,
Sorry.
on the latest developments in Europe with the variant strain, how concerned are you about that? Was that predicted, or is I don't know what the best phrase is, the variant or mutant strain? Is that something we thought would happen?
We absolutely expected the virus to mutate, to get a competitive advantage, as you might say. It will evolve, and that will continue to happen. And one of the things to point out is that will happen more as we use the vaccine, because when people are protected or immunised against the existing strains, the virus will try to find ways to get around the vaccine. We see this with influenza. So we did expect that to happen, and particularly because there have been so many people infected globally. So the emergence of the new strains is not unexpected. But I think another thing that is happening apace, and it is very promising, is that the vaccine manufacturers, including Pfizer, are already testing both in the laboratory and in people's response to the vaccine, whether or not the vaccines afford immunity to these new strains. And so far, certainly with the strain first identified in the UK, the results are promising. It appears to be for a couple of the vaccines that have looked at this that the South African, the variant first found in South Africa does have a reduced effectiveness for the vaccines, but it's still highly effective for the ones they've tested.
So what does that mean for our...
What's the latest on the general timeline for the rollout for the general population, start and finish for that?
Yes, so we had always anticipated that the wider general population rollout would be in the second half of the year, so from July onwards, and that will be, as of course we need much more vaccine on shore from not just Pfizer but from the other manufacturers. Those vaccines need to go through the Medsafe approval process, but we're still on track in terms of our preparation and in the discussions we're having with those manufacturers for that wider rollout in the second half of this year, so from the third quarter.
And ending roughly?
Well, our aim would be to have had every New Zealander able to access the vaccine before the end of the calendar year.
The 225,000 first batch, is that enough to inoculate all the frontline workers that you want to?
Yes, it's enough to do our border workforce and their whānau, as well as then some of our other workforces like those who work in very frontline health and emergency response roles, and also some of our more vulnerable adults, for example, those who are in aged residential care. So, it's quite a number of courses, 225,000, so I think it's very encouraging. Remembering that's just the first before the end of March that we are aiming to get here, and then there are further deliveries going on through into April and May. There was a question here.
I was just going back to vaccine hesitancy. You also spoke about the 10% of people who flat out refuse. So on that sort of vaccine misinformation, what concerns do you have around the spread of that misinformation?
Well, obviously it is a concern because there are many channels whereby that information can be spread. And it's beholden on us to make sure that we have got really good, clear information for people through a whole range of channels as well. And I think if we are successful in doing that, and we plan to be successful, I think we will see that group of people who at the moment say they won't take a vaccine, as they get increasingly confident and as they see the information and as they have that explained to them by people they trust, that group will get smaller. And we have seen this in the past where the group of people who oppose does tend to get smaller over time as they see and become confident with the use of the vaccine.
How are you actually going to do that?
Through a whole range of methods, and we've got a very significant communications campaign underway. You will see and hear more about that in the coming week or two.
What's the state of submissions from AstraZeneca and Novavax in terms of getting those approvals? And do you have a timeline in your head for when they might get provisional authorization?
So I might broaden that out if that's right. So we've got 3 other vaccines that we're working with. So the AstraZeneca vaccine, we received the application this week, and we've started receiving some data from AstraZeneca, and we expect to receive more in the coming weeks. So until I really get a sense of what data came in with that application, then we'll be in a better position to talk about timelines. And because they're all rolling submissions. Janssen is one that has, so we've had their application, they've been submitting data to us as it's available. That's progressing well. And timeline-wise, I believe Janssen is, its plan for data means that we'd be looking for a regulatory decision in the early part of the second quarter. And Novavax, it's quite early. We haven't got an application from Novavax yet, but we're talking to the company that's responsible for Novavax in New Zealand.
You're the only one with 1 jab, right?
That's right. Yes.
Chris, aren't you just in a sense duplicating what the FDA and European regulators have spent a lot more money and a lot more time doing?
Two parts to that, I think. Some countries have had to look at emergency approvals, emergency use authorizations, for within their countries because of the public health emergencies happening there, and looking at getting access to a vaccine based on perhaps limited data. We feel that it was necessary in New Zealand's situation that we undergo a rigorous review. So while we absolutely don't fully duplicate, we certainly look at the assessments from those countries, and that's really helpful. For instance, we can see that we've got a lot of common provisions in place for additional data compared with what Europe's put in place. So it's not about duplicating; it's about making use of those assessments but we need to make sure for New Zealanders in New Zealand's situation that the vaccine is safe and effective.
Why did Australia announce?
I guess I don't understand what's unique about New Zealand. I mean, I realise that there's no community transmission, but what makes it less or more effective for a New Zealander to have this than an American or a European?
Well, it's about the amount of data that you have. So countries that may have approved last year, for instance, didn't have as much data, both clinical data and manufacturing data, as we had.
Yeah.
We were receiving data up until the middle of January.
Yeah. I was going to say, Chris, there's nothing being done different with this vaccine that Medsafe doesn't do with every other medicine. We have our own medicines regulator to give approval for the use of medicines in New Zealand. That's why we don't use the TGA in Australia or the European medicines regulator. It doesn't mean, and New Zealand's a founding member of a group of medicines regulators around the globe, and they will be looking for us our assessments as well, because they'll be just as interested in them. But I think it can be, New Zealanders can be reassured that our people here didn't just take the summaries from those regulators. Yes, they had them, but they went back and looked at all the original studies and the data themselves. And I think that's part of the reason I'm confident that we can, tell New Zealanders that this vaccine is safe and effective for use in New Zealand. I'm just going to do one more sweep across the room. If that's all right.
You're a relatively small agency, Medsafe. It's a business unit of health. Are you able to look at several vaccines simultaneously? And how many staff do you have day to day working on this?
We have. That's why we've been planning. So we've been planning for many months, and what that means is I can allocate assessors onto each of the candidate vaccines. And so our planning means, and with the rolling submissions, it means that we're ready to go as soon as we get information. So there are no roadblocks with, an assessor needing to finish with the Pfizer vaccine to start on the AstraZeneca vaccine. I've got separate teams of assessors who are already looking at all of those, and we can assess up to 4 vaccines at once.
And roughly how many staff are working on that?
Well, it really varies. We have 80 people at Medsafe. That covers the medicines medical device regulation, and it varies depending on how many assessors you need on each one. So obviously you can't put 100 assessors on one application, because it's like having too many cooks in the kitchen. You actually don't have an efficient process.
And sorry, Dr. Bloomfield, when did you last get reassurances from Pfizer that they would be delivering in Q1? Was there a time in the last 2 weeks or so where they've said, yes, this is happening?
Yes, so the team's talking with Pfizer regularly, and as far as even the most recent conversation, which has been since the announcements by the EU, they are reassuring us that they are still on track for delivering to New Zealand in the first quarter of this year. And likewise, our foreign affairs colleagues are, of course, in discussion with their counterparts in the European Union about the impact of any decisions the EU may make. So they're already having those conversations.
In the last several weeks?
Days. Yes. So since the EU made its announcements in the last few days, we have been talking to Pfizer.
Dr. Wilson, can you just elaborate a little bit on that technical advisory group work? And so they're meeting with government tomorrow, is that correct? And sort of what will they be talking about? When will there be a decision on sort of what that looks like?
Yeah, so there are 2 components really to the, pushing the button, the green button. The first is, of course, getting the approval, which we've now got from Medsafe. And the second is we've got a framework which we're calling decision to use framework. And the reason this is important in this situation is because we've got 4 potential candidate vaccines. We've got different populations we might be administering it to, and we've got different potential scenarios we are administering the vaccine or vaccines in. At the moment, we're in a scenario with no community transmission, but we could be in a scenario where there is some, or indeed a lot, of community transmission. I should say we have no plans to be in either of the latter. And what this group is, so it's a group of scientists, the Scientific Technical Advisory Group. It's similar to the one that it includes many of the people who were on the one that has supported MB through its assessment of and agreements with assessment of data and agreements with pharmaceutical companies. It will have some other people. So N-Town's convening that group to look at, this is the output of the Medsafe process. Here's the situation we are in. We've got an idea of who we will vaccinate first, which groups. Do they agree? What are some of the parameters around the administration? For example, Dr. Town's already told me their advice is once the vaccine's been administered, their advice is that people wait for 30 minutes after that administration to just check there's no allergic or other serious reactions to it. That's longer than you would know we might have with an influenza vaccine. So that's the sort of practical advice we're getting from them. And as I say, they're meeting tomorrow. So within the next few days, we would be able to marry the two up.
So is the advisory group meeting, or they're meeting with government tomorrow?
So the advisory group is in effect a government convened advisory group. So Ian Town's doing it in his role as the Ministry of Health's chief science advisor.
And how are you, just quickly, how are you feeling about getting the jab?
Oh, I'm looking forward to it when it's my turn. I'm not in that first group. Obviously, I'm not a frontline border worker or health worker, but I will certainly be having the vaccine. And as I say, I'm very excited about not just reaching this point, but the trial data around safety and efficacy on this vaccine and the others is very, very promising, as is the information coming in from countries that are already administering the vaccine.
Overseas, are you able to say which groups of people the Pfizer vaccine is being used on?
Well, I think if we look at the UK as an example, I mean, they've done their frontline workers, but also have been prioritising, given they're in the middle of very high infection rates, they've been prioritising older people, people who are frail and vulnerable. And so it's great to see its use there, and again, good safety data coming through. But what they're also doing there is kind of wider vaccination events across the general population. So I think that's reassuring that we're vaccinating really all adults over 16. They are showing safety and efficacy as good in practice.
So you think it's likely we'll follow the UK sort of pattern in terms of who and when they vaccinate people?
Well, in the first instance, we'll be doing with that first tranche, that first group of people, and then there will come a point in the second half of the year we will do that wider rollout to the general population. But I guess after those who are most at risk, as it were, those at the border and our frontline health workers, then we would be looking to vaccinate in this scenario, that is low community or no community transmission, that we would be looking to prioritise people who, if they got ill, would be more at risk of a poor outcome. So that is our older people and people with pre-existing conditions. They're the same people who receive a publicly funded influenza vaccine every year.
With any frontline workers that refuse to get the vaccine, would you be recommending that they be stood down from those roles?
This is only something there's a lot of interest in and we're working on at the moment. What I would say is we have been working hard, very hard, as have they over the last 6 months, to protect them and their families from being infected. And the vaccine is another very important tool in protecting them and their families. I think, again, what's beholden on us is to make sure that workers at the front line, at the border workforce, are really confident about the information they are receiving so that they can make a good decision. And there may need to be options available if people, for whatever reason, won't be vaccinated, but we are doing work on that and we are providing advice. I'm working with my border colleagues on that, and we will be providing advice to government just about the options there, but that's forthcoming.
Like
What happens after the Pfizer vaccine leaves the deep freeze? How will it be kept cold in transit before it actually gets used, and how many days will it last outside of the special freezers? Could you talk us through and give us a bit of perspective on that process? So
two things on that. First of all, in terms of the -70, there are these 9 big new freezers that we've had put in here in Auckland and in Canterbury, in Christchurch. So they will be the 2 places where the vaccine will go to when it arrives on shore. Then there is the cold chain still at -70 to get it out. So sort of a portable cold chain to distribute it around the country. And then there is once it's thawed, as it were, it needs to be stored at between 2 and 8 degrees Celsius, and it's still usable for 5 days after that. So, the coordination of appointments and getting people in to make sure we're using the vaccine and none's going to waste is a really big effort.
That portable cold chain that you talk about, those are on the aeroplanes as well when it's brought to New Zealand?
Yes, so it's brought, and one of the things that has to happen when the vaccine arrives in New Zealand is there's a clearance process, and we have to verify that cold chain has been maintained right through the transportation here. And also we have to be confident onshore, once it's here, that cold chain is absolutely rigorously maintained while it's transported out to where it's going to be administered. Yes.
So that is quite complicated. How much of a risk is that that cold chain isn't maintained throughout its travel process getting to
Oh,
New
there's a
Zealand?
lot of work going in to make sure that we get rid of any risk there. Remembering we do have existing cold chains in place at that 2 to 8 degrees for virtually all our current vaccines, and so the health system is very used to maintaining and has a certified cold chain right through the health system.
So, when the sequencing priorities were announced on December 17, the elderly were in group 3, and you today have said group them with the border workers and with that 225,000 doses. Have they been promoted to elevated in priority? And also, when you mention aged care, do you mean retirement homes, or do you mean just the sort of managed care part of retirement homes? What do you actually mean?
Good questions. You picked up on that well. So what I would say is that since the first sequencing framework was announced in December, our teams have continued to look at the emerging evidence from around the world about what are the things that increase risk if people are infected, so increase risk of serious illness or death. And so there is quite good data now on a number of specific medical conditions like diabetes, respiratory diseases, heart disease. And one of the things that's really clear is that there is a very much higher risk in particularly the frail older people. And so in the advice we've given to Cabinet, and they've considered, and I think the Prime Minister talked about that there'll be more information released on this in coming days about the sequencing framework and some of the logistics. One of the specific things that we gave a recommendation about was to look to think about who our most frail older people are, and those are the people in aged residential care. I'm not talking about retirement villages, but people who require hospital level or rest home care in our aged residential care facilities. And of course we saw that early on in the pandemic here, the outbreak in New Zealand, that we had 6 of our facilities involved, and we saw that they really were at high risk.
There's been some frustration across Europe and North America just in terms of Pfizer's delays. So they've cut deliveries across Europe pretty deeply. In Canada, they just cut their deliveries by 56% for this coming month. Have they assured you that we're going to get all of those 450,000 doses or 225,000 courses within the first quarter, or have they just promised that something will be coming?
They've assured us around the 450,000 doses that are still on track for delivering those in this first quarter.
And based off the headlines that you're seeing all over the rest of the world, are you able to kind of point those out to them and just say, why are you missing everyone else's deadline?
Rest assured that's part of the conversation with them. I mean, we're wanting to seek an assurance that we will be receiving the quantum of vaccine that they have assured us they will be providing. And once we are confident, then we'll make an announcement about timing of that.
My understanding is you're spending $3 million on the first stage of the vaccine information campaign. Given that we're in an age of sort of fake news, is that going to be enough to combat the spread of misinformation?
Depends how long the first phase is. That could be just a week. I'm not sure. I don't have the detail on that. But if you think about our Unite Against COVID campaign that was so helpful and really critical part of our success just under a year ago in our elimination strategy, there was quite a bit of money spent on that. It was around 15 million, and I think it was an incredibly good campaign. So we won't be resigning from, using all the channels and spending the money that's needed to ensure that New Zealanders have access to really good information about the vaccine.
Do you have any detail on that campaign? Can you give us a taster?
I can't actually, but there will be detail coming. Thank you very much, everybody.